Chapter 14, the Paper Claim CMS 1500. The objectives for Lesson 14 is 1. To identify the circumstances in which paper claims continue to be used. 2. Discuss the history of the health insurance claim form, the CMS 1500. 3. Define and discuss the two types of claim submission. 4. Explain the difference between clean, pending, rejected, incomplete, and invalid claims, and discuss specific terms used to describe Medicare claims. 5. List the elements typically abstracted from the health record that are included in a cover letter accompanying an insurance claim. 6. Describe basic guidelines for submitting insurance claims. 7. Explain how the diagnostic fields of the CMS 1500 claim form should be completed. 8. Explain NPI numbers. 9. Discuss claim signatures, the importance of proofreading every paper claim, and supporting documentation for claims. 10. Describe reasons why claims are rejected. 11. Identify claim submission errors and discuss the solutions to correct the errors. 12. Identify techniques required for submission of claims. And 13. Demonstrate the ability to complete the CMS 1500 claim form accurately for federal, state, and private payer insurance contracts using current basic guidelines. The Paper Claim CMS 1500. The Administrative Simplification Compliance Act. All claims submitted electronically to Medicare. Some exceptions would be small providers, disruption of electricity or communication connections, any other health plan, technical downtime, reporting special services, resubmitting a claim, practice is non-participating, or report patient encounter data. Now, the paper claim is the basis for electronic claim submission, and many software and hardware systems depend on the existing CMS 1500 claim form in its current image. It is essential for health insurance billing specialists to fully understand the basic guidelines for submitting paper claims and how to properly complete the claim form. The history of the paper claim, the CMS 1500. The standard claim form was created in 1958. AMA approved a universal claim form in 1975. It was originally called Health Insurance Claim Form HCFA 1500. Recently called the CMS 1500 in August of 2005. And then it was changed in February of 2012, which is now called the CMS 1500. The advantages of the standard format will expedite claims processing in a faster way. Claim submission technology changed and new information was required on the claim form, so changes were necessary. The revised claim form made available for optical scanning in 1990. Revised form for the National Provider Identifier, the NPI, inclusion made available in 2005. CMS 1500, the August of 2005, is no longer accepted after October 1st of 2013. Types of submitted claims. The paper claims are submitted on paper or optically scanned. They are typed or computer generated. Your electronic claim is submitted via electronic method, a digital file not printed on paper. Claim status. A clean claim. It's a claim was submitted within the program or policy time limit and contains all necessary information. There are no deficiency and passes all electronic edits. Carriers does not need to investigate before paying the claim. Claim is investigated on a post-payment basis. A claim is subject to medical review with attached information or forwarded simultaneously with electronic medical claim records. given the general term for Medicare claims that are not considered clean and which require investigation or development on a prepayment basis. These claims are known as other claims. A physically clean claim has no staples or highlighted area. Barcode areas have not been deformed. A rejected claim is not processed or cannot be processed. And a pending claim is held in suspense because of the review or other reasons. Medicare claim status. An incomplete claim is missing required information. Invalid claim contains complete, necessary information, but is illogical or incorrect. A dirty claim is submitted with errors requiring manual processing for resolution or rejected for payment. A deleted claim is canceled, deleted, or voided by the Medicare fiscal intermediary. Now, most of these claims can be resubmitted with additional information. There is a time limit for processing participating provider electronic submissions, and that must be within 14 days of receipt. The time limit for processing paper submissions is within 27 days of receipt. Abstracting from medical records. The reasons for abstracting from medical records is to complete insurance claim forms. When sending a letter to justify a health insurance claim after professional services are rendered, or when a patient applies for life, mortgage, or health insurance. Now, there are legal issues of properly abstracting information from the patient's medical records. There may be legal guidelines to follow with patient information, such as disclosing HIV status or previous conditions. The Health Insurance Portability and Accountability Act, HIPAA, has requirements for this type of disclosure. Basic guidelines for submitting a claim. Individual insurance is a private insurance plan. A group insurance is usually through an employer, with the patient being a member of the group. And secondary insurance is when two insurance policies exist for the patient. Dual coverage is individuals have two insurance policies, and you will need to determine which policy is the primary and which is the secondary. There may be a time that you need to submit a claim for a patient who's got consecutive dates, and you need to know how to handle them on the form. They can be grouped together if each visit is consecutive, occurs in the same month, use the same procedural code, or results in the same fee. The total fee for the procedures should be listed in Block 24F, and the number of times the procedure was performed should be listed in Block 24G. Private carriers should be contacted for instructions. Now, how you handle no-charge services is do not submit an insurance claim for services that have no charge unless the patient requests that it be sent. You should only document these in the patient's financial and health record. Now, the patient's physician's identification numbers, they are the state license number, and it is required to practice within a state. The employer identification number, the EIN, is required for each physician in a medical practice group of a solo practice. The tax identification number, the TIN, is used by the Internal Revenue Service for income tax purposes. The Social Security number is used for personal use and is required if the physician does not have an EIN. Completion of insurance claim forms. The diagnosis goes in Block 21. The primary diagnosis code listed first, followed by any other secondary diagnosis codes. The CMS 1500 can report up to 12 diagnostic codes. The diagnosis should never be submitted without supporting documentation in the medical record. It is best to list only one illness or injury and its treatment performed unless there are concurrent conditions to avoid confusing services with multiple medical conditions. Dates must be consistently formatted in all blocks on the claim form. And should a claim form be filed if there was no charge for a service? And the answer is a no. You do not send a claim form in. Physician's identification numbers. The state license number, the employer identification number, the EIN, social security numbers, national provider identifier, the NPI, the provider identification number, the PIN, the unique physician identification number, the UPIN, the group national provider identifier is group NPI, durable medical equipment, DME number, the facility provider number, and the taxonomy code. Be sure to use the correct identification numbers on the claim form. The physician's signature. Be sure that the physician signs and initials claims where appropriate. The insurance biller specialist initials, proofread, supporting documentation, and the office pending file. Now, what should be included on all supporting documentation? And that should have the patient's name, subscriber's name, date of service, and the insurance identification number. Common reasons why claim forms are delayed or rejected. The reasons why they can be delayed or rejected is that the claim submitted to the secondary insurer instead of the primary insurer first. Information missing on the patient portion of the claim form. The patient's insurance number is incorrect or transposed. Patient's name and insured name are entered as the same when the patient is a dependent. Failure to indicate whether the patient's condition is related to employment or an other type of accident. The patient's signature is missing, and the physician's signature is missing. The dues for claim completion. Do use original claim forms printed in red ink. Align the printer correctly. Keep characters within border of each field. Keep new form for additional services. Enter 6-digit or 8-digit date formats. Keep signature within signature block. And enter information via computer keyboard. The don'ts for claim completion. Don't handwrite information on document. Don't allow characters to touch lines. Don't use specialized characters and fonts. And don't strike over errors. Don't use highlighter pens or colored ink. Don't use decimals in block 21 or dollar signs in money columns. Don't use NA or DNA when information is not applicable. Don't use paper clips, cellophane tape, stickers, rubber stamps, or staples. And don't fold or spindle forms when mailing. Block by block instructions for completion of the CMS 1500. Now you can see textbook for examples of how to fill these blocks out step by step. But for the carrier block, it's block 1. It's through Medicare, Medicaid, TRICARE, CHAMP VA, Group Health Plan, FICA, or Black Lung, or other. You put an X in one of those. Block 1A is the insurer's ID number. Block 2 is the patient's name. Block 3 is the patient's birth date and sex. And Block 4 is the insured name. Block 5 is the patient's address. Block 6 is the patient's relationship to the insured, such as self or spouse. Block 7 is the insured address. Your Block 8 is reserved for NUCC use. Block 9 is the other insured name. Block 9A is the other insured policy or group number. Block 9B is reserved for NUCC use. Block 9C is reserved for NUCC use. Block 9D is the insurance plan name or program name. Blocks 10A through 10C is patient's condition related to either employment, other accident, a motor vehicle accident, those kind of things. Block 10D are claim codes designated by the NUCC. Block 11 is the insurance policy, group, or FICA number. Block 11A is the insured date of birth and sex. 11B is the other claim ID designated by NUCC. Block 11C is the insurance plan name or program name. And 11D, is there another health benefit plan if the patient's got a secondary or even a tertiary insurance. Block 12 is the patient's or authorized person's signature, also known as the SOF, signature on file. Block 13, insurance or authorized person's signature, also can be filled out as SOF. And you got to make sure we've got these signatures on file to be able to use the SOF. Block 14 is the date of current illness, injury, or pregnancy LMP. Block 15 is the other date. Block 16 is dates patient unable to work in the current occupation, and you would fill that out with a workers' comp claim. Block 17, name a referring provider or other source. So if you are doing a specialist claim form, then you may have a referring physician on how the patient got to your office. Block 17A is other ID number. Block 17B is the national provider identifier. Block 18 is hospitalization dates related to current services. And Block 19 is additional claim information designated by the NUCC. Block 20, outside lab charges. Block 21 are your diagnosis or nature of illness or injuries. That's where your ICDs go. Block 22 is your resubmission and or original reference number. Block 23 is where you put the prior authorization number. Block 24A, the dates of service from lines 1 to 6. Block 24B is the place of service, lines 1 to 6. And that is actually where the office visit or whatever the services are being provided is the location of that. So if it's being done in the office, your place of service would be 11. And these are at the beginning of your CPT book, your place of service codes. Block 24C is the EMG, lines 1 to 6. Block 24D are your procedures, services, or supplies, lines 1 to 6. Block 24E, the diagnose pointer, lines 1 to 6, is where you're going to match up your diagnoses, your ICDs, with whatever procedure you're doing in the office. For example, if you are doing a chest x-ray on a patient who's got pneumonia and also came in with an ingrown toenail, you would diagnose point the chest x-ray only with the pneumonia because you would not be doing a chest x-ray on somebody with an ingrown toenail. 24F are your charges from lines 1 to 6. If you have multiple charges, you will add them up and bring them down to the bottom of that. Block 24G are your days or units, lines 1 to 6. And 24H is your EPSDT/family plan, lines 1 to 6. 24I of your block is ID qualifier, lines 1 to 6. Block 24J is your rendering provider ID number, lines 1 to 6. Instructions and examples of supplemental information are all in Block 24. Block 25 is your federal tax ID number. Block 26 is the patient's account number. Block 27 is the accept assignment block. And most of the time you want to put an X here. This means that you will get paid directly from the insurance company to the business office. The time that you will hit no in this block is if it's a non-participating provider or the patient is out of network. Block 28 are the total charges that are added up. Block 29 is the amount paid, and that is where you would put if the patient paid a copay. Block 30 is reserved for NUCC use. Block 31 is a signature of physician or supplier, including degrees or credentials. Block 32 is the service facility location information. Block 32A is the NPI number, and Block 32B is the other ID number. Block 33 is the billing provider information and phone number. Block 33A is the NPI number, and Block 33B is other ID number. Insurance program templates. And what these are is there are templates for the most common insurance programs encountered in a healthcare organization. Here are some examples of what the templates could be. A private payer, Medicaid, Medicare, Medicaid, Medicare, a crossover claim, Medicare, Medigap, a crossover claim, MSP, other insurance primary and Medicare secondaries, TRICARE standard, CHAMP VA, and workers' compensation. And this concludes the lecture of Chapter 14, Paper Claims, the CMS 1500.